Hi, this is Dr. Anuj Shah, the director of Apex Heart and Vascular, and I want to wish you and your family excellent holidays and a great 2021. Every year at the end of the year, I summarize the top 5 things in the vascular world and endovascular therapy that I am most excited about. We cannot begin talking about the top things in vascular in 2020 without talking about COVID-19. So if I were to summarize top 5 things that happened in 2020, number one is obviously COVID-19 infection, which truly is a vascular phenomenon. COVID-19 is a hypercoagulable condition, and it works with all three aspects of Workhouse triad, which is stasis, hypercoagulability, and endothelial injury. COVID causes all three. By causing endothelial injury, it also has a lot of procoagulants which get secreted, and a lot of people are lethargic and they don't move. And the end result is a number of patients ended up having deep vein thrombosis, which eventually went and caused pulmonary emboli, and a number of patients ended up having arterial thrombi as well. So anytime we see high D dimer, we are treating people with anticoagulation, and truly we are seeing vasculitis from COVID-19 causing other organ systems. So I think I won't be surprised down the road we're going to realize that a large majority of the damage, including mortality, done by COVID was due to vascular disease. So again, in my mind, that is number one thing we need to pay attention. Number two, moving to more exciting stuff, is the Voyager PI trial. So what was this trial? It's a double blinded randomized controlled trial which looked at people who got low-dose rivaroxaban, the brand name obviously being Xarelto. And what we found is that when people were placed on a little bit of a Xarelto, there is tremendous benefit in patients with peripheral arterial disease and blocked arteries. So I think medical therapy for peripheral arterial disease continues to improve along with the surgical therapy and endovascular therapy. Number three is a very sobering perspective, is critical limb ischemia. Despite all the advances in medical science, early detection and screening, critical limb ischemia still remains Achilles heel of peripheral vascular disease, no pun intended. Why so? Because when people develop limb ischemia, they still have absolutely horrible prognosis, not towards only their limbs, but also for their long-term prognosis for their life, right? So 1 year mortality is 25%, 2 year mortality is 40%, and by 5 years, 60% of patients who develop limb ischemia will not survive. And part of the reason is they get amputation at different level. The way to fix that is really endovascular therapy first. When people have blockages in their leg arteries and their limb ischemia, we gotta be aggressive. This is the foot attack, what we call it, where when people with peripheral arterial disease, and we really need to do everything in our capacity to improve their circulation. Nowadays, we have tremendous improvement in improving blockages not only below knee but below ankle with pedal loop technique, and improving blood flow all the way to digital blood vessel in the toes, in the metatarsal arteries, and in the calcaneal arteries. So going to the advanced number 4 in 2020 is intravascular lithotripsy. What is that? We know that when people have blockages in their iliac arteries or severely calcific vessels, now we can use the same lithotripsy that we use for renal stones or kidney stones. We can pass a wire and a balloon which delivers a lithotripsy therapy, which has really great result. And the benefit is a much less risk of perforation, much less risk of bleeding and extravasation, and incredible results in improving the stent delivery and well expansion of the stent. So you will probably see somewhere else. I was fortunate to be doing the first intravascular lithotripsy case in the Hudson County very recently, and we're very excited with this new device called Shockwave, which is truly creating waves in the world of vascular disease. And number 5, in my opinion, the number 5 advances in 2020 is the smart devices. 2020 has been the year of virtual visits, televisits, and similarly for peripheral vascular disease. Now, people especially with diabetes, we can detect diabetic foot ulcers much earlier because there are smart socks. There are all these wearable devices on the feet which can do thermal mapping of the foot and tell us when and where is the risk of developing future ulcers, areas of the friction and areas of hypoperfusion, and which in turn will help detect the disease early and help us fix it early. So once again, to summarize, top 5 things in the world of vascular disease in 2020. Number 1, obviously, the tremendous impact COVID-19 has, and it kind of humbled us by showing what a fatal vascular phenomenon like COVID-19 can do to us. Number 2 is interesting updates in rivaroxaban in Voyager PI trial, great outcomes. Number 3, I would say is CLI, how it still continues to remain a problem, and the tremendous advances we have in limb ischemia patients. Number 4 is intravascular lithotripsy, especially with the shockwave device. And number 5 is the smart socks and wearable devices which can detect disease early. Thank you so much for listening to this. I wish you and your loved ones an excellent 2021 and happy holidays.